Hello everybody. Today I am going to tell you how you can quickly find out whether you have signs and symptoms of chronic metabolic diseases and chronic lifestyle diseases like diabetes, high blood pressure, heart disease, and even cancer. So stay tuned and stay with me. Welcome to the Healthy Drive. This is a journey about your health. Join me on this journey to understand the chronic metabolic diseases and how to deal with them. And this is going to be the 4th episode. I would like to thank each and every one of you who have given your feedback and have encouraged me on this project. Hundreds of you, in fact, have contacted me and told me that you find the content very, very useful. So I am absolutely delighted and I hope to keep this going. And on that note, if you haven't yet subscribed to the channel, please do. A channel subscription would be wonderful and very healthy, of course. I'm going to give you a short recap of what I told you last time. As you can see in this picture, hyperinsulinemia and insulin resistance is the real cause behind lifestyle diseases. It is the elephant in the room that everyone misses. This is what is known as a unifying theory of chronic lifestyle diseases, which is becoming more and more clear as research is progressing. And it is this hyperinsulinemia which is driven by the food that we eat, and especially refined carbohydrates. You can see that I have parked my car, and that is because I have an important message to tell you, and that is a disclaimer. Yes, before I begin this episode, I would like to put in a disclaimer. My videos are for informational purposes only. What I am sharing here is designed to help you to make informed decisions about your health. It is not intended to serve as a substitute for professional medical advice. You must consult and work with your doctor to make any changes in your lifestyle, and especially if you are on medications. I am here to help you, to give you all the information that you may need to convince your doctor. Yes, it might be difficult to convince your doctor that nutrition can be therapeutic, that you may not need medications for your chronic lifestyle diseases like high blood pressure and high blood sugar and other entities. But let me assure you, whatever information that I give you is 100% based on published medical evidence in the medical literature. So you need to take this information with you and work with your doctor, and so that both of you can achieve the health that you need. So that is the disclaimer. Now, why is insulin resistance so often undiagnosed? Whenever we think of insulin, we think of it as a medicine for type 2 diabetes, right? We think of it in the context of high blood glucose and to bring that down in type 1 diabetics or in the later stages of type 2 diabetes as a medication, as an injection. So what has happened is we have all developed a glucose-centric view, and this has kept us from thinking that this hyperinsulinemia and insulin resistance is a part of all the other chronic underlying diseases. Now this is buried deep in medical literature, and this has not been translated into real world practice. So that is the problem. So that needs to be made aware to everyone. But the real problem lies in the fact that any change in medical practice takes a very, very long time. For example, as long back in 2015, the American Heart Association and the USDA have already told that dietary cholesterol is no longer a nutrient of heart disease, or no longer a nutrient of concern as far as heart disease is concerned. But that has not translated into practice. So anything in medical practice takes a long time. So all the more reason why this awareness about insulin resistance being the underlying cause of metabolic diseases has to be spread as a message as soon as possible. As I told you in the beginning of the episode, I am going to tell you how to find out for yourself whether you are having hyperinsulinemia. Question number 1. Do you constantly crave for sugary and starchy food? If you do so, then probably you are having hyperinsulinemia. As I told you last time in this graph, that whenever you eat starchy food, whenever you eat food which has refined carbohydrates, the blood sugar tends to shoot up, and then it crashes down to sometimes even below normal because of the insulin which is secreted along with the high carbohydrate food, and this causes the craving. And if this goes on throughout the day, you feel this craving for sugary food, craving for starchy food, and this continues, and this leads to hyperinsulinemia. So question number 2. Do you have fat around the belly? If you have belly fat, that means there are good chances that you have hyperinsulinemia. How to find out whether you have belly fat? Just measure your waist in inches and measure your height in inches and divide the waist in inches by the height in inches. For example, my waist is 32 inches and my height is 66 inches, 5'6" inches. I am not very tall. So if I divide 32 by 66, the value I get is 0.48. So if your waist height ratio is less than 0.5, it means you are healthy as far as hyperinsulinemia is concerned. But any value more than 0.5 means you have belly fat. So please remember that the waist height ratio is an indicator of insulin resistance. Question number 3. Have you been frustrated by failed attempts to lose weight with a low-fat diet? Now, the problem with low-fat diet is it is not very satiating because our satiety center in the brain is stimulated by the healthy fat that we eat and the protein that we eat. For example, you must have noticed that the fat and the protein comes together in nature. Like eggs, they come with the fat and the protein together. Like the oily fishes, the protein and the fat come together, and the fat that you get with all kinds of meat, the protein and the fat come together. So when you eat fat and protein together, it stimulates the satiety center and you don't feel hungry for a very long time. Now this doesn't happen when you eat low fat food. What happens here is you reduce the number of calories but you remain hungry. Now any diet which keeps you hungry throughout the day will keep you craving for food, and it doesn't work over the long time because then it becomes a diet, and once the dieting period is over, then you feel like eating more and more, and you land up having a weight which more than what you started with. So if you are feeling frustrated with low fat diet, this is the reason. Question number 4. Do you have high blood pressure or high blood sugar? So as I already told you, high blood sugar or type 2 diabetes, when it is fully manifested, is nothing but hyperinsulinemia and insulin resistance. By this time, what has happened is your pancreas is beginning to wear out and it is not able to put the sugar inside the cell as it is supposed to. So that is why the blood sugar remains high. But this may be silent for decades. I will tell you more when I talk about type 2 diabetes. And high blood pressure, mind you, is also a result of hyperinsulinemia, because insulin, in addition to being a hormone which stores fat, it has also got growth-like effect. There is something known as insulin-like growth factor. This kind of hardens, or rather thickens the small arteries in the body, which leads to high blood pressure. It has been found in countless patients that once you reduce the amount of refined carbohydrates in your diet, the blood pressure seems to normalize, the medications come down and even disappear. Okay, so question number 5. Do you have high triglycerides? Whenever you do a lipid profile, have a look at the triglycerides and have a look at the high density lipoproteins. So these are the two things which indicate that you might have insulin resistance. How is high triglyceride important? Because whenever we eat food which is high in carbohydrates and high in refined carbohydrates and sugar, what happens is the excess of it is stored as glycogen in the liver, and even if that is surpassed, it is stored as triglycerides both in the liver and in the other fat areas of the body. So it results in a hypertriglyceridemia, as we call it, high triglyceride. And if you have a look at the HDL, that is high density lipoprotein, which is known as the the good cholesterol. So if you divide the triglyceride by the HDL, the ratio should be around 2. That is, if your triglyceride is around 100 and your HDL is around 50, so it gives you a ratio of 2. Anything more than 2, anything more than 3 and above is definitely hypertriglyceridemia, that is, your triglycerides are very high, and this is the parameter to look at when you are doing a lipid profile. Question number 6. Do you have a fatty liver? This you can find out by simply doing an ultrasound. An ultrasound of the liver will tell you if you are accumulating fat in the liver. Now, if you have fatty liver, it easily means that you have hyperinsulinemia, because it is insulin which is storing the fat, and once the adequate amount of glycogen is exceeded in the liver because of the excess of refined carbohydrates that you have been eating, it converts into fat and stores not only in the liver but also in the other organs, but the liver is affected first. And the unfortunate sad fact is more than 75 to 80% of the population has fatty liver. And even more tragic is the fact that nowadays you find 8-year-old, 10-year-old, pre-teenagers and teenagers, all of them having fatty liver, thanks to the faulty nutrition that has completely engulfed us. So this is the tragedy, and this is the direct reflection of insulin resistance. Question number 7. Do you have patches of dark colored skin? By patches of dark colored skin, I mean that sometimes you see in patients, especially who are having diabetes, or especially who are obese, they have dark colored patches around their neck, in the axilla, or in various parts of the body. Now, this is known as acanthosis nigricans in medical terms, and is a direct reflection of insulin resistance in the body. I will go into the details later on in maybe another episode. So, question number 8. Do you have gout? Gout means raised uric acid, as you know, and it causes joint problems. That's what we all know. But more important than that is that gout is a part of your metabolism, and it is a part of the fact that you are taking in excess of not only glucose but fructose. Fructose metabolism leads to raised uric acid level. I will tell you the details later on, but basically raised uric acid levels in the body means that the body is crying for help, and once the metabolism is corrected by addressing the nutrition, gout can also be taken care of. But mind you, hyperuricemia and gout is also a metabolic disorder and is a reflection of insulin resistance. Question number 9. Do you have a family member with insulin resistance or type 2 diabetes? If it is so, it is also possible that you are having it. I'm not going to blame it on genes, most people, what they do is, when you come across metabolic diseases, we try to just blame the genes and get away with it. Now in genetic science, we have a saying that the genes may load the gun, but it is the environment which pulls the trigger. So it is possible that there is some genetic disposition for the metabolic diseases like diabetes and high blood pressure and other diseases, but you don't have to get it necessarily. So if you can control your environment, and most important thing being what is in your hand, that if you can control what you eat, the trigger will not be pulled. So remember that, and there is hope. Question number 10. Do you have a family member who have had gestational diabetes or polycystic ovarian syndrome? Gestational diabetes means diabetes during pregnancy of the mother. So it has been found that if the mother becomes a diabetic during pregnancy, not only the chances of her becoming diabetic later on in life is increased very much, the children also are prone to become or to develop diabetes later in their life. And as far as PCOS is concerned, polycystic ovarian syndrome, unfortunately, we Indians in India are the PCOS capital of the world, where the worldwide ratio of PCOS is only 10%. We have in India 1 in 5 women, that is 20% of the population in the reproductive age group, having polycystic ovarian syndrome, which is a huge tragedy. This is something which is very, very sad, because PCOS is one disease where mainstream medicine, we know this since 1980s, that it is nothing but hyperinsulinemia, and all that we have done is try to give medicines to bring down the insulin levels instead of addressing the real cause, and instead of addressing it by therapeutic nutrition, which is the concept which I am going to talk about later. So once again, do have a look at all these 10 questions. I am going to keep this slide going for a few seconds, and this will help you to quickly find out for yourself whether you have hyperinsulinemia and insulin resistance or not. Another very easy way to find out whether you are having hyperinsulinemia or not is to do a blood test and measure the serum insulin. Now, traditionally, serum insulin is not asked for by most doctors, mainly because measurement of blood sugar is really very easy to do, whereas insulin is an assay, and it takes time to get the result, and it is expensive. Hence, this is something which is not frequently done. But if you can do a serum insulin, and the normal laboratory value which they give you is 2 to 25 microliter units per ml, but anything more than 7 could be classified as hyperinsulinemia. And if you measure the fasting blood sugar along with the fasting serum insulin, there is a calculated value which is known as HOMA-IR. Just remember the name. I will give you the details later on. Now, why I am stressing so much on the insulin levels, on hyperinsulinemia and insulin resistance? The fact is that the process of healing every major disease, from cancer to diabetes to heart disease, has at its core the same basic approach, that is, to optimize your diet to improve your insulin sensitivity and bring down your insulin resistance. In fact, your variability of lifespan is regulated by insulin. The lower your insulin levels remain throughout your life, the better longevity and the better health you are going to have. So this is the reason why hyperinsulinemia has to be addressed, and the problem is it cannot be addressed by medications, because as I told you, medicines do not work. Medicines just try to attain a particular parameter, and although it may be capable of reducing or maintaining the parameter, but over a period of time the disease itself gets worse. I gave you the example of type 2 diabetes last time. You give medication to bring down the blood sugar, but as the years go by, you need 2 medicines, then you need 3, and after that you need insulin, and after that you may go on dialysis, because by the time the kidneys and have end organs damage have started occurring, and all the doctors will tell you is that diabetes is a chronic progressive disease. But the answer is, but that is not so. Let me tell you, that is not so. I will tell you details when I discuss about diabetes. So if you just address your nutrition, type 2 diabetes can be reversed. No one, absolutely no one should suffer from type 2 diabetes. Hence, this importance on knowing what your insulin levels are and addressing the root cause is what my message is. So how do we address this hyperinsulinemia and insulin resistance? As I have told you, the good news is that it is in your hands, because hyperinsulinemia is driven by the kind of food that we eat, and if you can address that, it can be reversed. Not only that, it can be quickly reversed. So we are going to look into that in the future episodes. And since today's episode had some very important messages, I most of the time I parked my car so that there are no distractions. But let me tell you that this is something which can be tackled, which can be reversed, not by medications, but by nutrition, but by lifestyle changes. And we are going to go into the details of it in the subsequent episode. So once again, it has been wonderful talking to you. Please do tell your friends about it, like this video and share it with your near and dear ones, so that everybody benefits. And meanwhile, next time I'm going to go into the details of how to tweak your nutrition to address this insulin resistance. And I'll be back soon, and I'll catch you next time. Tata.